Everyone able to see the slide deck? Yes, awesome. All right. Good afternoon, everyone, and welcome to the Healthy Eating Active Living Workgroup meeting. I am so excited to be here with you all today. Thank you for your patience while we waited for others to join us. I know it's kind of lunch hour for some and maybe getting into lunch for others. So if you need a snack and some water, that's totally fine. I don't mind. But again, just thank you all for being here. If you don't mind, as you enter, just please type your name and organization in the chat box so we know that you're here with us. And just as a reminder, this meeting is recorded, but thank you all so much for your participation today. I am Shanae Vicks, your new Prince George's County Health Action Coalition Manager. And again, I'm really excited to be here with you all today. We will have a moment in a few to share a little bit more about me, but right now I'd really like to get to know you. So I'm sure we've probably done introductions before, so bear with me. But I'd really appreciate it if you all could kind of just go around the squares and introduce yourself, tell me your name, your organization, and your role. And our icebreaker question for today, if time and money were of no concern, which I know for me is time is definitely a big concern for me, but where would you travel for a summer vacation? I know we're nearing the end of summer and some of us may have already gone on vacation to our dream spot and maybe others like me haven't gone anywhere. But if time and money were of no concern, where would you travel for a summer vacation? And I can't see everybody while I'm sharing, so please feel free to kind of just jump in or tag a friend. Would anybody like to start?
Shanae, I'll go ahead and start. Hi, everyone. For who I haven't met so far, my name is Devin Hardesty. I'm with MNCPPC, Department of Parks and Recreation, Prince George's County. I'm a Health and Wellness Coordinator. And time and money were of no concern. I would like to go back to Waikiki.
Nice. Awesome.
I'll pass it on to the next person.
Hey, everybody. I'll go. This is Jessica Moyes. I serve as the HEAL co-chair, but I'm also the vice president of community impact with the American Heart Association. Let's see. Gosh, I guess I should have had my answer before I decided to come off mute, right?
No judgment, no judgment.
I know, no judgment, right? Okay, let me think. If I could pick any place to go in the world right now, you know what? One of the places I've had on my bucket list for a while is to, let's see, I've been wanting to go to Greece. So I definitely would go to Greece. I think I would do like the authentic like Athens and do just like the very like historical tour of Greece and maybe and like that would be, and just go there maybe for like a good like 2-3 weeks or whatever. And that would be obviously if I had that much leave and could really get into the culture and learn about that. And then maybe do a little bit. And I feel like also when you're in Europe, you can always take the train and maybe do a little bit of traveling. So maybe go back. Maybe go back to Florence. I love there, and go to Rome and maybe do a couple of other countries while I'm there too. So that kind of would be if I had no concern over money and time. So that's my answer for that.
Thank you for sharing.
Mm-hmm.
Anyone else?
I can jump in to reintroduce myself. So
Sure.
Good afternoon, everyone, and welcome, Shanae. My name is Taylor Palmer. I was previously with the coalition, so good to see some familiar faces. I'm still with the health department here in Prince George's County, but I am now with our health and wellness team with our diabetes prevention program. So great to see everyone. And I am a huge fan of motorsports, so I would love to go to Monaco. If money wasn't an option, there's a bunch of millionaires. In order to live in Monaco, you have to identify as a millionaire, and I am certainly not one of those. So if money was off the table, you would definitely see me in the south of France and Monaco.
That's really cool. Thank you, Taylor.
I can go next.
Sure.
Hi, everybody. I'm Kate McGrail. I'm from Suburban Hospital. My colleague Emily Samuel is not able to make it today, but you might recognize her name as well. She's actually in the county right now taking blood pressures at some of the senior centers.
Awesome.
And we also collaborate with some partner groups on this call with the Dine, Learn, and Move program. And Emily has taken over this role for me. However, I still share a healthy aging newsletter each week. So if you're don't receive it, let me know. I'll put my email in. We'd love to share news about what's going on to share resources for healthy aging.
Great. Thank you. Yes, please send that. I'd like that.
My name is Gwen Hector. I'm with the Health Department. I'm in the Food Protection Program. We are the one that regulates the grocery store, restaurants, schools, nursing homes, and many more in the food industry. I'm from the islands. I just love the water, no matter where I am. I would have liked to go to Iceland for the summer. I did it in the winter and it was beautiful. And I heard it's awesome in the summer with long days. So I would like to experience that nonstop fun and barbecue.
I love that. Thank you. Nice to meet you as well. Any others that would like to share?
Yeah, I can go. It's so nice to meet everyone. Some folks I've known before and some new faces. So my name is Michelle Burton. I'm a program manager with the Institute for Public Health Innovation, and I'm also the program manager for the Food Equity Council. And I love this question because I too have not really traveled this summer, but dream of traveling. And gosh, so one thing I really want to do is I actually want to drive all the way to Argentina. And yeah, that would take a long time, but that would be really cool because then you could stop all the way. And I'm also a mountain biker, so I can mountain bike. The other place I'd want to go is mountain bike in Bhutan and like mountain bike in the Himalayas. That would be really cool. But then another thing that I would just love to do is I do stand-up paddleboard. And they have this race where you paddleboard to Alaska. And you said no time or time and money are not of an issue. So that would be kind of wild to be on a paddleboard. But I think you start in Vancouver. And so that would be really cool to experience that, and probably scary. Those are some of the things. Yeah. Wish I could just travel.
That's great.
I don't know. I'm dreaming of retirement. I'm hoping it'll happen one day and I'll be able to do that. Something while I'm still able to move around.
I love that. Thank you for sharing, Michelle. Is there anyone else that'd like to share?
Sure, I'll go. Good afternoon, everybody. I'm Maisha Dunan-Cover, and I sit on our Community Health and Social Impact team at Care First Blue Cross Blue Shield. For me, in the summer, I'd love to go on the flip side in the Australian summer and go down under and do Australia and New Zealand, particularly because I'm a huge tennis fan and I want to go to the Australian Open and then travel down there in the South Pacific, extended break and vacation. So that would be a dream, and especially it's our January, so that would be an incredible time.
That sounds incredible. Thank you for sharing.
Sure.
Anyone else?
Hi, I can go. My name is Twanisha Stokes. I'm with the Health Department. I'm the Program Chief for Chronic Disease Prevention and Health Promotion Unit in the Health and Wellness Division. And if I had money, if money wasn't a problem, I should say, I would love to go to Spain and Portugal.
That's beautiful. Thank you for sharing, Twanisha.
Okay.
Anyone else? All right. Well, I guess I can end if there's no others. Again, I'm Shanae Vicks with the Prince George's County Health Department, your new coalition manager. And if time and money were of no concern, I would like to go to Fiji or Bora Bora. I'm sure I could think of some other places, but those were the first
That
two that
is-
came up in my mind. And I
That
don't
is
know
what
why,
I'm
but they just
talking
sound
about.
really tropical and pretty.
Yes, I'm thinking of that for my 60th birthday.
Oh, well, plan it. I'll be there. We can celebrate. I love that. All right, well, we can move on if there's no others. Okay, so we'll now actually have our co-chair Jessica provide us with a review of today's agenda and our work group vision. Jessica? I don't know if you're muted or if you're still with us. I'm working with one screen, so I can only see the presentation.
I think Jessica may have dropped.
That's okay. So I'll go ahead and just share about the agenda. We've already started with our welcome and introductions. Our other co-chair, Devin, will just share a little bit about me. And then we will have a fantastic presentation from Ms. Michelle Burton from the Institute for Public Health Innovation with some updates on the Food Equity Council. And then Taylor will jump in with our legislative updates. We'll share some community announcements, and then we will adjourn for the day.
Oh, I apologize. I have
That's
no idea. It
okay.
just kicked me off. I am so sorry.
No,
Shanae.
that's
I
okay.
had one job.
It's okay. I'll leave the vision to you. So feel free
Okay,
to share
perfect.
the vision.
Got you. I'm so sorry. Yes, for some reason it literally kicked me off. I'm back on now. Okay, perfect.
It's okay.
Vision. Sorry everybody about that. Yeah, so wanted to share the vision for the healthy eating, active living work group. So the vision for us is going to be that Prince George's County is a place where everyone has access to fresh, nutritious food and environments that promote good health, wellness, and active living. I know that we're really working towards like a new vision for us, a new work group, and we're still, Shanae, I think I know we have yet to meet, but we really are trying to promote and add new members to the work group and incorporate kind of like what it really is going to be looking like moving forward as we're working towards this new vision in the years to come. And I know that we're really looking at what in Prince George's County is going to be kind of just like a healthier county in general, and really putting together like different organizations, different community members, and just figuring out what it's really going to look like as we're really trying to move that needle when it comes to overall wellness and well-being in the county. So this is a vision that the county has come up with in order for the work group, but we're really hoping to really just really drive that and equity, health and wellness, and really instill that in for the county and for the work group.
Thank you so much, Jessica. You did that way better than I would have done. So
You're fine.
you
Thank
hopped
you.
back on just in time. Thank you. Okay, so now we're going to hear from our second co-chair, Ms. Devin, who's going to will introduce me as the new co-chair manager. I'm sorry, the new manager.
Sure. Hi, everyone. I hope everybody can hear me okay. I just wanted to take a second and thank everybody for taking the time to meet with us today and introduce our new coalition manager. Shanae Vicks is a passionate health educator and public health professional dedicated to advancing health equity and health literacy. Originally from Southern New Jersey, she moved to Maryland to earn a Bachelor's of Science degree in psychology from Morgan State University. She later earned a Master of Science degree in public health from the Johns Hopkins Bloomberg School of Public Health, with a concentration in health education and communication, and a certification in maternal and child health. In recent years, Shanae has deepened her focus on community health, health equity, and health literacy, working to ensure that populations facing systemic barriers have equitable access to education, services, and resources. Through active collaboration with community organizations, leaders, and members, Shanae's work reflects a commitment to culturally responsive, community-informed approaches that prioritize those disproportionately impacted by health disparities. Shanae, we're excited to have you on board.
Thank you, and thank you all for having me. I look forward to working with this work group and all of our work groups, and just really affecting some change in this county. So thank you all. Feel free. I will make sure that my email address is in the chat box, or if Taylor, if you don't mind just dropping that in for me on my behalf, I really appreciate that. So feel free to just reach out at any time if you want to connect, so I can meet you and learn a little bit more about your organizations and what you all do and your vision for this work group. So thank you. All right, so now we're going to move on to our presentation. We have again Miss Michelle Burton from the Institute for Public Health Innovation, who will be sharing with us some updates about the Food Equity Council. But before she begins, I'd like to share a little bit about her. Michelle Burton serves as the program manager for the Prince George's County Food Equity Council, where she leads strategic initiatives to strengthen the local food system through policy development, community engagement, and cross-sector collaboration. In this role, she managed the council's Food as Medicine initiative, advancing the integration of nutrition access into clinical care by promoting food arts models and aligning local policies to support health equity. Recently, Michelle has also worked closely with the Prince George's County Public Schools to improve school meal participation and expand access to healthy foods for students in under-resourced communities. She regularly partners with government leaders, community partners, and advocacy organizations to shape effective community-informed policies. So Michelle, we are so grateful to have you with us today to share. When you are ready to advance to the next slide, you can just let me know and I'll be happy to do that for you, okay?
Yeah, if you want to just start with slide number 2. Yeah, there you go. Perfect. Okay. Yeah, well, thank you so much for having me today. I've always been part of the HEAL work group for some years now, so it's great to be here and to share a bit about the Food Equity Council. So I just kind of joined as the program manager a few months ago, so still in a little bit of a liminal space right now, but this is part of us hitting the road. So in case you don't know what we do, we're a local food policy council, and we help with strengthening the local food system. And so that includes not only supporting our food pantry providers, but also our growers. And so we just had our community garden summit last month, where we talked about how we could strengthen that partnership that already exists between community gardens and our food pantry providers. But we also have a lens for how we can increase the number of healthy food options, throughout the county, and so that the residents have access to fresh local produce. And we also work with the school systems and a number of partners. And so this is our email if you want to reach out to me. We'll be talking more about some of our upcoming projects. Oh, you can go to the next slide. So our mission is to create a fair, sustainable, and resilient food system for Prince George's County. We do policy advocacy, working with local and state level food system reforms, looking at how we can reduce food insecurity, how the specific interventions that we look at are also addressing the persistent chronic disease that we have in our county, and also thinking about food access broadly. We also want to bring together diverse members together to include both community leaders and local agencies and institutions, such as our University of Maryland and other academic institutions together. We also provide evaluation support and system planning and accountability. We do some data analysis in our reporting to judge how well we're doing that. And so we're the only organization solely focused on sustainable policy level change in the food system. Go to the next slide. So we've been around since 2013, and some of the work that we've done has included helping our local growers and food entrepreneurs with farmers market permitting, reducing those fees, extending hours. Many folks remember us from the Maryland Market Money Program, which matches those that are purchasing food from local farmers markets with either their SNAP benefits by matching at $1 for each dollar purchased. So that increases their buying power. And that also extends to WIC as well as Sunbucks. And then there are some senior and also I think there's benefits for seniors that also would fall under SNAP, but might have a different looking card, and working with SNAP Ed and how we can increase access for folks to take advantage of that. And also that strengthens our local farmers. We also were part of the Prince George's County Food Security Task Force, which created a roadmap of how we could increase food security for the county and several recommendations. And I'll talk about some of those reports later on. We'll go to the next slide. Yep. And so here, if you want to see some of those recommendations that were made in 2021, that is online, is on the county council website. We've been using that as our roadmap for how we're guiding future directions for the Food Equity Council. One of them being working with strengthening school participation in the school meals program. We recognize what an incredible job it is to create school meals, and it's such a successful program that we want to ensure that all families can access it. So we did some focus groups with students and school staff as well as parents to understand how we could address any of those barriers that's preventing them from accessing the school meals program, and how we can support our schools in that process. And so we were able to meet with the new FNS director and with other community advocates. So I hope that we can continue to support the school meals program into the future. And so we're definitely looking towards solutions for that, as we know there have been a lot of legislative changes that has impacted programs such as the Farm to School program that has impacted our students, and also the federal security net programs have been impacted, and that may affect school meal participation because that rate is determined by participation in those programs. And then previously in 2023, we did the evaluation of Prince George's County First Food is Medicine program. And so you can find out all of how that went in that report there. You can go to the next slide. So a little bit more about what we do. So we also have another sector where we're looking at how we could establish the county's first food hub by recognizing that we need to integrate both the growers, the food that's grown locally. How do we get it ready to distribute to other food pantries? There is a lot of the production work that needs to go in before food is ready for the market. There's also concerns around, how could we make it prepared so that it can, if we want to preserve it, if we're not able to distribute it quickly enough, what are some ways that we could preserve that food or prepare it so that it could last longer into the winter months. So all of that would go into what a food hub would be with additional cold storage. And so our director at IPHI, Evelyn Kelly, is leading that. And so right now they're working with community partners, detailing the roles and responsibilities and investigating, kind of doing a landscape assessment of what that would take to get to that point. And so we could integrate different components of the food system. And then also what I've been doing is working on updating our comprehensive online food assistance directory that has all the food pantries in Prince George's County with their availability and location. And so if you have questions about that or want to be involved with it, please reach out to me, as I have a community health worker who's working on updating each line. And once that's ready, we're going to have that translated in the top 5 most spoken languages in Prince George's County so that you could disseminate that on your website or in person with your clients. You can go to the next slide. One of the achievements over the past year was the farm tax credit. And so you could see our former director, Dr. Camille Grange here with local legislators. This is one of our work groups with the urban farm and local agriculture work group, feel free to join us if you want to learn more about how we can advance the structural changes that would help our local growers. And so right now we're trying to disseminate information about that tax credit. We meet once a month and we talk about some of the challenges that our local growers, both small and large, face in the county and how we can overcome those challenges so that we still have a local food system. Because as you know from the lessons from the pandemic is that when the supply chain breaks down, you really do need that local system to rely on. And so what are the things that we can do to support our local farmers and growers? Okay, we go to the next slide. One of our projects this year that we're happy to announce is that we're working with Brighter Bites. They provide nutrition education for students as well as teachers. And they also do food distributions where they distribute fresh produce for families. It's for all the members of that school. We are working with 6 schools in the county. We determine those schools by looking at where the highest food insecurity is, and then also, reached out to schools to find out who's willing to take on this program. And so Brighter Bites takes care of the nutrition education and the food distribution. What we will be providing are 2 community health workers who will be using the CRIS platform that will refer families to local resources, as well as additional services that they may need in addition to picking up that food. For example, we know that they could pick up that food twice a month, but they may need additional food support, or they may need other social support for their family. And so that's what our community health workers who are bilingual in English and Spanish will be providing on site. And then we'll also be doing culinary demonstrations with a nutritionist team throughout the school year and trying to do cook-alongs with the families or recipe books. And so all of that is in the works. So if you're interested about that, if you are a program that wants to be more involved with the school families and want to do a table event during the school year, please reach out to me and we could see when we, which school might be amenable to that and when we could schedule you for that day. Okay, go to the next slide. All right, this is where I'm also going to look at you all for some help and input. The other big project that we are trying to lift off is food recovery. So we know that there is a lot of food in the United States and in Prince George's County. The problem is that it's not always distributed to where there is a need. And there's also a time and transportation component that affects how we get this food to the areas that are in need. And so one of the things that we're doing is working with the team of NourishNet, which is received a National Science Foundation grant. It's with the University of Maryland and other partners such as the Linda Benn Foundation. So what it is an app called Chow Match, okay? And this app would allow for the growers or the food distributors. That could be local farmers, that could be local grocery stores or restaurants, or even a gas station or 7-Eleven. If they have surplus food that they would like to donate, they could get on this app and they could announce that they have that food. All right, then it's about finding a local volunteer, somebody who's willing to go to that place and pick up the food and drop it off at a willing food pantry. So we also need to get our food pantry partners to get signed up on this app so that they could receive that additional food. And then, of course, the volunteers, we would also have to leverage a group of volunteers who are willing to travel from one place to another to drop it off. And so that is all what I'm trying to recruit people for. And then finally, we would want the actual folks that use food pantries to participate in the app. Again, this is all in the testing rollout. We're not ready to share with the public, but right now we're trying to see how we could best design this app. It's already designed, it's in the testing phase, but what changes we need to make so that it could work smoothly for all residents. And so we would also want to do some focus groups with clients that use food pantries to see how this app benefits them. What are some things that we need to, adjust in the interface? And eventually the goal is that if you have dietary preferences, you could indicate that on the app. Let's say you needed fresh greens because for your diet, you could indicate that you want that. and then it would show on the map where you could get it. And so the idea is that it could make it easier for food pantry clients to find what they need from their local pantries. And it's also to support our local pantries with getting additional food donations. And then also it would include an inventory so that we could know what was being distributed and where. And we could also potentially even look at doing more of an emphasis in areas where there's high food insecurity or more food swamps or deserts and so on. So there's some planning components that this app could be beneficial down the line. And it could also help our smaller food pantries who are not able to take large food donations because of their size and their storage space, but they could still have an ongoing donation mechanism throughout those weeks. All right, you can go to the next one. All right, so I just shared a few questions because the way we look at food is that from the Food Policy Council, we don't just see food as something that you eat, although it certainly is that. It's your nutrition, it's part of your health care, it's part of your journey, your healing journey. It's also part of our infrastructure. It's part of our history and our culture. And so to me, food is, encompasses so much more. And there is also the economic component of food. So knowing that we all come from different backgrounds and we're working with different communities, I would like to take a minute and answer any questions you have, but also to learn more from you of how, knowing what we've done and what we're doing this year, how could we serve you? What are some of the challenges that you are seeing in the communities in which you serve? And what are some solutions that you're seeing that's working? I would love to see what's benefiting the community and things that we could uplift, we could strengthen, ways that we could come in and support what is working and what you're already doing. And then also, because there hasn't been a lot of engagement over the past year with some of our policy work, I think we haven't been able to connect with some of the new programs and initiatives happening in the county. So who are some partners or programs that you think we should be connecting with? How could we build a stronger bridge so that this perspective of nutrition access, food access is within other conversations? I always bring it up because this is part of our economic landscape. It's part of our educational landscape. It's more than just having grocery stores, even though that is definitely a part of it. So looking broadly. And then let me know what your vision would be, because as we're making plans and thinking about the future, I'd also like to know what's important to you when you think about what a thriving, equitable food system should look like, and what are those components, so that as we're planning for our next steps, we keep that in mind and keep that as our guiding light for what we do moving forward. So I'll stop talking. I appreciate you all giving me some time today to share about the Food Equity Council. Our next meeting will be in October. And now I'll just kick it over to the group to hear your feedback and what you all are thinking. Thank you.
Thank you. Does anybody from the group have any initial feedback, questions regarding the presentation, or would like to respond to any of the prompts on the screen?
I had a question, Michelle, about the app. Have you guys looked into the Too Good to Go structure? It seems like it's like there's an existing local structure in that realm. Are you familiar?
Yeah, that's a great question. And yes, Too Good to Go is another one that is on the ground. So that is someone that we could reach out to understand how they work. I'm not sure if they work, what their work is with food pantries. So that's something to dive into further. So what we plan to do is some focus groups with our food pantries. So again, anyone who's connected with the food pantry in the county that would like to give me their input of who do you work with? because I know that there are several different apps that are being used. I know that Feeding America also has an app. And so my predecessors had opted for Chow Match. And so that's what we're working with. But I do understand that could be confusing if people are already using other apps. So all of that is something I would really like to suss out between our residents who use food pantries, between our food pantry partners, and then also our growers. So if you want to chat more about it or connect me with somebody, if you know somebody from Too Good to Go, that's definitely part of my fact-finding mission and my landscape assessment that's going to contribute to making this this initiative stronger.
Thanks. Unfortunately, I don't have a contact, but.
Oh, yeah. No worries, but thanks for bringing it up. It's definitely important to keep in mind. Well, thanks for that. Yeah. Anyone else seen any food-related challenges on the ground? Are there any things that you think that I need to be aware of that we need to be responding to or considering how we roll out our projects? Another thing is, are people concerned about the future? So if you're not experiencing it now, or there are future concerns thinking about that we should be aware of as a group and thinking about planning. That's just another way to think about the question.
Michelle, I have I guess a comment or a question. I've I've been aware that some individuals are hesitant to seek help, maybe due to stigma, or I don't know if maybe they've had past negative experiences while trying to seek food assistance or anything of this sort. And then others just don't know what exists. And then on the other hand, there's almost too much that exists and people don't know what to use or what to select. So I guess what is your group's approach to kind of addressing that stigma and just the concerns around just the lack of awareness or the overabundance of knowledge resources?
Oh yeah, that's definitely such a challenge. And I would say that we definitely saw a big drop in folks being engaged with public resources since there was the public charge concern. And I would say that that's why we're trying to use the work of community health workers who are bilingual and are residents. And I'm also a resident. And so the hope is that we're going to build relationships by getting to know people just one-on-one and just hear what their challenges are. I recognize that people are not going to be upfront with challenges that they're facing, food insecurity. There's a ton of stigma with that, as well as other challenges too, such as intimate partner violence. That's not something that people are going to be necessarily upfront with, but they may be experiencing. And I think building that trusted relationship, I think word of mouth is still very important. We are in a time where I would say my observation is that we're seeing a lot of distrust of institutions. And I feel like that is the hole that folks like me in a public facing service are trying to dig our way out of. And I can only say that what I can control is just working locally and building relationships one by one. And I think people will observe over time if it's helping. And so technically speaking, the way that we're going to do the referrals is through CRISP. And I hope that that service would be helpful. The intention behind CRISP is that it is a closed loop referral platform so that the receiving organization would receive that referral and we could see the status of that. I have been in situations where I write down a number or a website on a piece of paper and I give it to a person, and we all know that challenge because it's giving more homework to the participant. And so the intention is that we're trying to take that step away to make it easier for them so that the organization will call them. I know there's another closed loop platform with Unite Us. And so I think we're in a space right now with the technology of seeing like who's going to win out and what's the best model. We're using CRISP because it's free, it's local, and I know that the reason I'm using it is also because the health department is also using it, and we hope to integrate with local initiatives such as Prevention Link and diabetes prevention education programs that are available. So that was the intention behind that. And so the hope is that if we provide a quality service, that will increase people's willingness to participate. I don't know what to do about having, if it's too much resources. I think that would be, how do we create materials? And I would just ask for people's input. We would probably have to draft something up. That's like a common problem everywhere, is how do we keep a good resource list? And we're going to leverage folks like 211 and find help along the way, because in my experience, it's just hard to have one repository, but hopefully one day we could have that central source. If it exists and I'm unaware, please let me know. But that would be the dream, to have everyone on there and that it's continually updated.
Thank you.
Yeah, and I'll just say I'm here to learn alongside with you. So there may be things I'm unaware of that you need to call my attention to. This is such a big county and there's so many projects going on.
Thank you. Okay. Well, I think for the sake of time, Michelle, if anybody has any additional questions, if it's okay that they maybe follow up with you via email, and if that's okay, feel free to drop your email in the chat, and they can reach out to you with any follow-up questions, comments, discussion. But thank you so much. This was a really great presentation. I really appreciate you taking the time to share with us today.
Yes, and I'll just say that the flyer for the NourishNet, if
gotcha.
you all wouldn't mind sharing that with your partners, as I said, this is going to be a huge, huge initiative. And I need all the help I can get, to be honest. So if you could spread this around to see if there's anyone interested. Again, I'm going to need volunteers and help being connected to folks, as I'm just trying to get things off the ground and reaching out to folks individually, which is pretty time consuming. So if you all have suggestions or could help boost that, that would be great. Thank you very much for your time. I'll put my email in the chat.
Thank you. And I will make sure that this flyer goes out subsequent to the meeting with the minutes and the video and everything. So thank you. All right, we will now have some legislative updates. The amazing Taylor Palmer, if you don't mind sharing some very important legislative updates that are happening.
Absolutely. First and foremost, thank you so much, Michelle, for joining us today and for your continued partnership. You've been a partner in this game for many, many, many years. And so really appreciate you continuing to keep folks updated and see additional ways to plug into these spaces. So in an effort to continue, again, increasing awareness of what is going on across the county, Michelle alluded to this, there's so many different programs, so many different initiatives that are happening. So want to make sure that we are closing some loops and bringing this information back to the HEAL work group. So two of the updates that I'm going to be giving today are centered around healthy eating and overall health and wellness. So the first update I wanted to give comes from the Maryland General Assembly. So something for us to track. By December 1st of 2025, there is a report that will be coming our way that is going to be led by the Health and Wellness Work Group. So the Health and Wellness Work Group, it is actually outlined by the state who needs to be a part of that work group. So we're looking at, county council members, representatives from the Parks and Rec department, different local health and wellness businesses. So those folks are going to be a part of this new health and wellness work group that is going to be convened by the Prince George's County Health Department. That work group is then being tasked by December 1st to come up with a report that outlines the following information. So they're going to have to do a deep dive of the availability of health and wellness practices, services, and programs across the county. They're going to have to look at some of those integrative health and wellness programs. So what is happening in the community versus what's happening through our local clinics. We're also going to have to talk about in that report specific government-led health initiatives. So what's being offered in the workplace, part of workplace wellness practices. And this will all culminate to offer recommendations in that report as to what comes next. Again, looking at that entire landscape of health and wellness practices across Prince George's County. And then also the state, their really high up vision is to have more of these integrative health hubs across the state. And so looking at that report that will need to be generated by the Health and Wellness Workgroup. They also want comment on the feasibility of those health hubs here in Prince George's County and what sort of model those would look like. So we'll keep folks updated, but just wanted to give this update. Again, this is something that has been passed down from the state at the state level to the county, but again, will be a resource for you all to reference moving forward, again, as it looks at an exploration of the landscape of health and wellness initiatives, and will really have a significant overlap with the HEAL work group with many of your organizations. So more to come here. I will go ahead and put the bill in the chat if folks want to look up, read more about the specifics of the legislation. Any questions about this state Senate and House bill? If not, we can go to food as medicine next. All right, and then at the county level, I told you guys a lot's happening around healthy eating, active living. So really excited to see some new legislative updates. So at the county level, as of June 1st, Council Member Blagay, she introduced the Food as Medicine Health Program Act of 2025. So this piece of proposed legislation would mandate that the Prince George's County Health Department would be required to administer food as medicine programs. So you can see here, I outlined some of the areas of responsibilities that the health department would have to implement, but essentially it's all centered around creating and managing food as medicine programs, working with those partners who are in traditional food as medicine spaces. So whether it be farmers, the grocers, the nonprofit organizations, also looking at medically tailored meals. So this bill has a pretty significant scope, and food as medicine programs, as well as food subscriptions and medically tailored meals, are also under the umbrella of this proposed legislation. The health department would also be required to provide some technical assistance to those partners who are implementing food as medicine programs, as well as applying and being able to allocate some funds to support food as medicine programs. And at the end of this Food as Medicine Program Act, it is hoped that we could have some sort of report that talks about best practices and next steps for the future of food as medicine programs in Prince George's County. So next steps with this bill, with this proposed legislation, it is going to committee on September 4th. So if folks are interested in commenting or, again, seeing how, your organization would react to this legislation, I will go ahead and put it in the chat. Feel free to reach out to me. I know Michelle's been a leading partner with IPHI in this legislation. We've talked to our friends over at Giant, the American Heart Association. But again, if you feel that your organization has any stake in food as medicine programs, or if you have any expertise in this field, we are asking for your opinion, for your expertise. Again, this legislation is still in draft form, so there is still opportunity to, have that conversation with County Council about how we can mold this to best be able to support Prince George's County residents. Any questions or reactions to the Food as Medicine Act? Michelle?
Yes. Will there be a food as medicine work group that works to implement the bill moving forward?
So that has not been decided. So that will be a topic of conversation when it goes to committee on September 4th. So from the health department's perspective, Stephanie Little, she is the Chief of Health Policy and Innovation. Many of you all know Stephanie. She is the thought leader for the health department to offer the health department stance and to take a look at legislation and see the impact that it would have on our agency. So happy to connect you all with Stephanie if folks have any more specific questions about food as medicine, or again, if you have any ideas or, again, have any opinions from your expertise with food as medicine, please do offer those up ahead of that date when things go to committee.
But just a question, Taylor. Is the University of Maryland medical medical systems, are they also engaged with this? Because I would wonder if through their community benefit program, if that's one way that if they would be interested in funding this.
Yes, so they have been involved in conversations. They have a food as medicine program right now that they are running with the Capital Area Food Bank. So they kind of have that dual perspective as a thought partner with implementing food as medicine partners, as well as a possible funding stream moving forward. And I know we have some representatives from the University of Maryland Capital Region Health on with us today, as well as Adventist. So if you all would like to have a follow-up conversation, again, I put the information here in the chat. Let's certainly follow up on this and see what our recommendations would be moving forward.
Thank you, Taylor, for sharing those legislative updates with the group. I really appreciate that.
Absolutely.
Yeah.
Thanks, everyone, for the time.
Sure. All right, so in these last few minutes, I just want to briefly kind of go over some community announcements and give you all an opportunity to share any as well. So I'll kind of rush through these a little bit, but August is National Immunization Awareness Month, where, organizations all around are utilizing this observance month to really highlight the importance of vaccination for people of all ages. So Prince George's County Health Department is hosting their back to school vaccine clinics between August 6th through September 27th. There will be a variety of clinics offered there's weekend availabilities and weekday availabilities at multiple locations throughout Prince George's County. So the link is embedded in the slide, and I'll make sure that you all have access to that. The American Heart Association recently released their August drop-in newsletter with really great information and resources around the topic of staying safe and heart healthy this summer. The hyperlink is embedded on the slide, and again, I will be sure to share that with you all. IPHI is hosting their Community Health Worker Conference and Career Fair, Rooted and Rising Community Health Workers for Change. The fair will be on Thursday, August 21st from 9 to 4 p.m. And I'm hearing great things about this conference. Just that it's going to really just offer like peer-to-peer learning, some practical workshops, networking opportunities for anybody who's a CHW or partners of CHWs to really just work on affecting change in the DMV area. So the registration link is provided. If you are interested or know someone who might be interested in attending, please feel free to register. The cost is $25 per person. And I think the last announcement that I have to share, Park and Recs just recently released their fall guide, which again is another great resource for community members. It just shares the different programs and resources to help support overall health and well-being. So the hyperlink is embedded on this slide, but again, please feel free to share this with your partners, with community members. And at this time, I will open the floor for any announcements that you all would like to share. Or if anything, I kind of like briefly spoke to just now, if any of our partners want to kind of expand on, you're more than welcome to at this time.
This is Kate again. There's one more. I don't know if it's made it to anyone here, but with partners with Every Mind, some of the hospitals are supporting a session on the 988 service as a way to prevent, hospital, ED visits as a resource. And it's specifically for providers on August 19th and August 21st. So there's a daytime and an evening option. It's free, and there will be CEUs offered for those who are eligible. And then there will be one in early September for the community at large to learn about the 988.
Great. Thank you for sharing. If there is a flyer or anything that you could,
I'll make sure you have that.
Thank you, and I'll make sure that goes out with the recording. Thank you so much for sharing. All right. Hearing no others, Devin, would you be gracious enough to close us out for today?
Sure. Thank you all again for being with us today, taking your time to join us. Just a quick reminder, our next PGHAC virtual quarterly meeting is on Tuesday, September 9th from 6 to 7:30 p.m. And our HEAL Workgroup meeting will be on Wednesday, October 1st at 12 p.m. We appreciate your time today, and we look forward to seeing you at our upcoming meetings. Thank you, everyone.
Thank you, everyone. Have a great afternoon.
Thanks.